So you did a lecture at IPS, International Peptide Society Symposium this year that clearly was amazing, because you didn't just talk about theory, you talked about application and actual results that you were getting with patients in the autoimmunity sphere. So let's start there. Talk about the presentation you did and how you even came to start to focus on autoimmunity with peptides.
Well, the pathways are really critical. Those are things I didn't really learn about in medical school, or if I did, I sort of skipped over them. The pace is so rapid that you don't really get a chance to dive in and really grasp what's happening. And so now learning about the pathways for maybe the second time and hearing how there are things we can do that influence those pathways makes a big difference. I also see in my practice over and over again patients who are sick but whose labs look fairly normal, whose regular labs look normal. And so trying to figure out a way to heal them was what started me on this journey in general.
Okay, and so peptides are relatively new on the scene. I happen to know that you are part of the mastermind group at IPS. You are one of the physicians that's actually blazing a trail. Instead of just learning, you're actually contributing to the learning process. When did you introduce peptides into working with these patients that seem to have normal blood work but had a lot of really horrible symptoms?
About 2 years ago. So we had, I have several patients who are like that, who I just knew there was something wrong and we needed to fix them. Or I knew they had autoimmune things and we had treated them with all of the standard protocol therapies, things that you would use, starting with their gut, starting with even using things like low-dose naltrexone. But either they had side effects or they didn't tolerate, or for some reason they were not responding to standard of care even in functional medicine realm. And so just by looking for another thing to help, I went to, I guess it was an A4M conference where I heard someone speak about mechanic growth factor. And I had a hip injury at the time that I'd been nursing for a while, probably 2 years. So I ran home and figured out how to order the mechanic growth factor and shot myself with it and got so much better fairly quickly. So I decided to pursue the fellowship in peptide therapy with IPS and A4M.